This video is part 2 in a series of videos that are meant to debunk some of the myths that are associated with arthritis. One very strongly held belief by some of my patients who have arthritis is that being physically active or exercising is going to exacerbate or make their arthritis worse. And as I will demonstrate, the evidence does not support this belief. A matter of fact, studies show that exercise, even some running, can help reduce some of the symptoms and help improve function in those people who have arthritis. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in arthroscopic surgery and sports medicine. Because of the pain associated with arthritis and the stiffness, about 20% of people with arthritis have some functional limitation. And therefore, many older adults who have arthritis believe that exercise is going to worsen those symptoms and reduce their function. However, this myth has been debunked by a very good study, about 5,700 people who were 65 and above, and they followed them out for about 2 years. And they started with people who had arthritis. Some had some functional deficits, some didn't. And they found that those people who do not exercise had almost double the odds of a functional decline over those 2 years in those people who started with no problem. And if, let's say, somebody started with some functional deficit, they had almost a 3-fold increased risk of further decline if they weren't being physically active. So exercise, very important in people who have arthritis to prevent further decline. The next question is, will exercise and physical activity cause arthritis to progress faster? So quick aside, in our joints, at the end of the bones, we have a smooth coating, like a Teflon coating, and we call this cartilage. And when this starts to wear away, that is a hallmark of arthritis. Now, there was a study of about 700 people with arthritis, and they followed them over 4 years with MRI. And what they found was that those people who were doing exercise and physical activity, they did not lose any more cartilage than those people who were sedentary. In fact, in women who were either moderately or doing light activity, they compared them and they found that those women who were doing moderate levels of exercise had less cartilage wear than those who were doing very little. So in women, it looked like in this study, it was actually protective of them losing more cartilage. As we age, one of the things that happens is that muscles can atrophy and weakness can occur as people get older in their muscles. Now, one of the risk factors associated with developing arthritis as people get older is having weak muscles. And there was a study of about 3,800 people, and they followed them over the course of about 2.5 years. And what they found was that in women who had weak muscles compared to those who had strong muscles, had almost a 65% greater risk of developing arthritis. Now, another similar study of women with arthritis found that those who had very significant weakness compared to those who were strong had a 70% higher risk of ending up needing a knee replacement. These are compelling arguments for people to maintain strong muscles and to exercise. Does the intensity of the exercise people perform have an impact on the risk of developing arthritis? So let's start off with low impact like walking, and then we'll work our way up to higher impact activity like running. There was a study of about 1,200 people, average age in their 60s, and they followed them for about 8 years. And these were people who had arthritis. And what they found was that those people who were involved with a walking program had reduced the risk of developing pain by 40% compared to those people who were sedentary and not walking. And now that we established that walking helps reduce pain in arthritis, does walking have any effect on the progression of arthritis? And so here there was another study that looked at people with arthritis to see how many of them would progress to needing knee replacement surgery. And what they found, very interestingly, was that if someone was doing moderate intensity walking, so walking a little faster, versus someone who was walking at a very slow pace, they actually were able to reduce their risk of needing knee replacement surgery by 35%. Now let's amp it up to running. So we were talking about walking. Now what about running, where we have higher intensity, more impact on the knee? What will that do? Will that cause more problems with people who have arthritis, or will it be helpful? The perceptions around the safety of running in people with arthritis varies greatly between healthcare professionals and the general public. And there was a very interesting study that was done in Canada where they surveyed a couple thousand healthcare professionals and a few thousand general public people to get their response on how they feel about running if they have arthritis. And in this survey, they looked at pain, progression, and the safety of just running in general in arthritic patients. And what they found was that in the general public, about 50% of those people felt that running with arthritis would exacerbate pain, whereas about 25% of healthcare professionals believe that. Now, with regard to progression, so about 40% of the general population was concerned that running with arthritis would progress their arthritis faster, whereas only about 20% of healthcare professionals believe that. And then finally, about 85% of healthcare professionals, they felt that running with arthritis was safe as long as the person was not having any symptoms. Now that we know how people feel about the risk of running with arthritis, what does the science show? So there are studies that have looked at this. And there was a study that looked at about 1,200 older people, our average age around 63, and they followed them for a few years. And they found that those people who were running recreationally actually reported an improvement in their pain symptoms. Now, additionally, there was no evidence of more progression of the arthritis on x-rays in those people who are recreationally running. And it's important to realize that not everybody with arthritis is the same. If someone is able to run, they self-select that they can run and don't have pain, then we can encourage those people who have arthritis, go ahead and keep running because the science shows it's okay. However, there are going to be some people with arthritis that can't do their running because it's too painful. And so in those people, we want to modify their activity to low-impact things like cycling or swimming. Let's wrap up this video and go over a few key points. We just debunked myth number 2. Based on scientific studies, those people who have arthritis and they are physically active or exercise, they will not exacerbate their symptoms or progression of their arthritis. Number 2, a lack of regular moderate to vigorous physical activity in patients with arthritis either doubles or triples the risk of further functional decline. Number 3, so walking in patients who have arthritis can actually help reduce pain and helps reduce the risk of progression to needing knee replacement surgery. And number 4, recreational running seems to be safe in those people who self-select to do so without the risk of increasing their symptoms of pain or progression of the arthritis any faster. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.